Welcome to the PharmaVOICE 100 one-on-one video series with Karen Groen.
Roz, thank you so much for joining us for our one-on-one conversation.
It's wonderful to see you. Thank you.
Roz, you have spent the majority of your career focused on patients. In fact, some say you are a pioneer of patient centricity. Why is it critical that patients are part of healthcare solutions?
Well, first, I'm humbled when anybody says that I'm a pioneer, and I want to recognize the many pioneers who are the first and fast followers who are continuing to drive this patient centricity movement. And critical is the right word when you're talking about patient centricity, because as you said, we're talking about healthcare solutions. And why are we even creating or designing healthcare solutions except to solve problems and answer questions? So whose questions and problems are they? Those questions and problems belong to patients and their families and their care partners and to their communities. And that's at their core. We have to know what those questions are. And in order to know, which of these solutions to bring forward, and also to know whether or not they're really addressing the problems in a way that matters to people, we have to ask, and we have to listen very carefully to better understand, and also to co-create with each of our stakeholders. This is not about asking patients instead of asking healthcare professionals or other healthcare stakeholders. This is really looking at patients as experts, as additional experts in their lived experience and in what they could bring forward to tell us, as far as what they need and what they want. And we have to do that if we have any chance of healthcare delivering the outcomes that matter to people. I'd say that medicines and devices and healthcare solutions have to fit into the lives that people are living, and they have to fit in with the life goals and the healthcare goals that people have that are unique to themselves. And I would say that patient centricity is not purely altruistic, nor is it optional. It's, when you think about what a successful business is, it's to meet or exceed the expectations of its customers. And our ultimate customer is patients.
Excellent, Roz. I know that you're a doctor, and in fact, your new consultancy is called RozMD Patient Affairs Consulting. So I am very curious to know, what's the story behind your story of stains unwashed from my white coat? Tell me about this.
Thanks for asking that, Taryn. Those 6 words came together as my story during a Healthcare Businesswomen's Association Executive Women's Workshop. And I was challenged in that workshop to take 6 words that would tell the story of who I am and why I do what I do. And I thought about it for a while, and I thought, stains unwashed from my white coat. That works because I'm a physician and a patient, and I bring the experiences of working directly with patients, holding their hands and getting close enough that the sweat and the tears would drip onto my white coat. And those were tears of fear, of grief, and of joy. And the tears belonged to patients and their family members, and they were also mine. And I've held on to those experiences throughout my career in clinical practice and in academia and in industry, so that I could bring them forward toward that goal of healing. And the story is also a connection to how I got here personally, in that my father was an immigrant who had huge dreams for his daughters and very little formal education. And he sold, among other things in his store, coats. So when I received my symbolic white coat in medical school, and he asked me to, I came down to his store wearing that white coat, and I can see as clear as day his face right in front of me, beaming with pride. So that's my story, because when I think about it, embedded in my fabric of my white coat and also embedded in me over the years are those experiences that help me to feel the urgency and that help me to listen and learn so that we can transform healthcare through human-centered design.
Roz, thank you so much for sharing your very personal story with us, and thank you for doing all you do for patients. It was great to see you.
Thank you so much for all you do.
For more PharmaVoice 100 content, visit www.pharmavoice100.com.